Today's question is, my cat has kidney failure and needs IV fluids, but my vet doesn't have overnight care. What are my options? So moving on to question 4, we've got a cat who has kidney disease. They've got really high levels of creatinine and urea and SDMA in their blood. So those are parameters or markers of the kidneys potentially not working very well. Certainly with SDMA, we can get a high urea and creatinine with a dehydrated cat. But anyway, their cat's been diagnosed with kidney disease. She's going on IV fluids to try and flush out the system, to try and get those levels down. And the vet is anticipating that's going to take 4 or 5 days to happen. But the vet doesn't have overnight care, so what are the options really? What's the likelihood of another vet taking her on where they won't have to spend, extortionate amounts of money? And certainly after hours care overnight can cost an awful lot in some situations. So let's start with the fact that IV fluids, they are often needed for a cat with kidney failure when they become unwell, and certainly this can sometimes be the first presentation and the first hint that there is a problem with the kidneys going on. Now, so long as the damage is not too advanced, then these cats can do very well with this treatment. The IV fluids flushes the system, it flushes all these toxins out of the system, it gets a cat eating again, they feel a lot better, they start eating, they get put on appropriate treatment, which is often dietary management, treatment to control blood pressure, treatment to stop protein leaking out through the kidneys, control nausea, anemia, all these other things. Now, they can do very, very well is the bottom line. So it's definitely something that's appropriate and worth pursuing. Now, IV fluids, intravenous fluids, they are not risk-free if a cat is left unattended. If too much is administered too quickly, then ultimately they can effectively drown a cat. The excess fluid builds up in the lungs, that compromises their ability to breathe, and they effectively drown. And also we need to think then that a cat with kidney failure is more sensitive to these excess fluids. In a normal healthy patient, while they can still get what we call fluid overloaded, the kidneys are able to cope and they're working really well, and they're able to kind of pump out and get rid of this extra water that's being administered through the IV drip line. But in a cat with kidney failure, that's something that they're not able to do. So the risk though of this is still very low, so long as caution is taken. So we want to give fluids at a rate that is rehydrating the patient, but we don't want to overdo that. And really, this fluid overload, it's very unlikely if an appropriate rate is chosen and a fluid pump is used, compared to just using a kind of gravity-fed drip line. Unless, of course, there's an equipment failure and the fluid pump breaks and starts pumping excessively. But really, that's the chances of that are really, really slim. So the most likely thing if a cat is left overnight is that the fluids will become blocked. So that therefore, obviously, not get the benefit of those fluids until the blockage is cleared in the morning. But that in itself isn't necessarily a dangerous situation, so long as they're not blocked for a 24-hour period, which is obviously not going to happen. There's never going to be a situation where a cat is left for that period of time. Certainly depending on the office hours, it could be 14 hours, but so long as the fluids are running for a little bit, the period of obstruction is unlikely to be for more than a few hours. But that's something to bear in mind. So really, when it comes to overnight care options, you need to talk to your vet about what the options are. So they may be happy for your cat to stay in their hospital overnight, so long as you accept the fact that there is a risk, albeit a very, very small risk involved with that. I currently work in an area where there's no 24-hour emergency clinic, or there's no overnight emergency clinic. And so this is what routinely happens to patients over here, is the fact that they are left overnight, they're left on an appropriate rate of fluids, and it's a very similar situation to what this cat may be going through. And really, apart from the catheter becoming blocked overnight, never had any problems at all. Now, that's not to say that they're never going to happen, but the chance of that is very slim. They may be, your vet may also be able to advise you on a different low-cost option for your area where your cat can be transferred overnight. So there might be different options there. That's not an expensive emergency clinic. But then the other option, or the only other option that doesn't involve an overnight expensive stay or transfer, is accepting that your cat might only be able to be on fluids over the day and then has to go home at night. So that's, another thing to consider. Is it ideal? No, it's not ideal, but it's certainly something to think about. And then when you're at home, if you are doing this, when you're at home, there are a number of other ways that you can try and maximize water intake. And there's a number of ways we can do that, like I say. one thing to think about, certainly in kidney disease patients, when they may not be eating very well, is actually giving subcutaneous fluids. That's something that can be done at home. It's a case of giving fluids under the skin, and it can work, reasonably well in this situation. It's nowhere near as ideal as intravenous fluids, but it's definitely something to consider. So really the take home is talk to your vet about the different options. There are definitely other options out there. They may not be quite ideal, they may come with a slight risk, or they may not give the full benefit, but there are definitely other options if you're not able to afford or not wanting to afford the high cost that can be involved with 24-hour care.
You've been watching the Dr. Alex Answers video podcast. Remember to subscribe and head over to dralexanswers.com for any links, downloads, and get your question answered.